Georgia. I'm going to be your nurse. I'm just performing hand hygiene. So I'm going to sit in the chair next to you, and we're going to go over a health assessment today. But before I do that, I wanted to say that I will be speaking to my professor as we go about this, just so you know that I'll be explaining things verbally.
Okay.
So before we go any further, could you verify your name and date of birth for me?
Windsor Weston, 62190.
Okay. Windsor Weston, 62190. Okay, great. Thank you, Windsor. So are you in any pain right now?
No.
Okay. And do you know where you are?
Yes, I'm at home.
Okay. And do you know approximately what time it is?
It's the evening.
Okay. Wonderful. So for the head to toe assessment, I'm going to be looking at your skin and testing some range of motion, and if at any point you have any questions, please feel free to ask.
Okay.
And if you experience any pain, then please stop me.
Okay.
Okay. So first I'm going to start with the top of your head. I'm going to inspect your scalp. This is just looking at the hair growth and making sure you don't have any bumps or nodules or anything that needs to be looked at right away. It doesn't look like you have anything out of whack, so that's good. I'm just palpating your scalp and your skull. Everything looks good there. Then looking down at your face, it has good color. The color is appropriate for your skin tone, and it doesn't feel, it's warm, but it doesn't feel too warm. It's not moist, so it's appropriate. I don't see any lesions. There's no bruises or any rashes. Do you have any allergies, Windsor?
No allergies.
Okay, great. So just doing a visual assessment of the skin on the face, that's good, but then looking a little further at the eyebrows, I'm also inspecting those, and I'm looking at each of the eyes to make sure that they're free of discharge, they don't have any bruises or any discoloration. There's no cyanosis anywhere on his face. I'm looking at his nose, and I would have an inspection tool, but I don't, so I'm just going to use my fingers. And your nostrils look clear, your nares look good. Do you have any problems breathing?
No.
Okay, great. So then I'm going to just notice that your lips are the appropriate color. They're not blue, which might indicate that you're not getting enough oxygen. So everything looks good up here. We are going to do an inspection of your back to take a peek at any moles you may have. So I'm going to have you lift up your shirt. So when I am looking at the back of Windsor's neck and back, I'm going to start with the back of the neck up here. And first it's important to do a visual inspection before I start palpating. And I'm looking for any discoloration. You can sit up straight if you want to right now, if that's more comfortable. Any discoloration. I'm looking for wounds. I'm looking for anything that's concerning in terms of moles. So if I did have any concerns, then I would share them with Windsor and also document them appropriately. So I'm doing a visual inspection, and your color looks good. You don't have any dry skin, and there's no excessive moisture, even in your lower back, which may be concerning for pressure ulcers if you're sitting a lot. So now I'm going to palpate just down the back of your neck. I'm feeling for symmetry, and I'm feeling for any nodules. So I'm just going right down your spine right now. Okay, great. Well, thank you for that. And I'm going to just continue the assessment downwards. So I'm going to take a peek at your stomach, if you don't mind. So first I'm going to just visually assess the stomach and look to see if there's anything on the skin in terms of lesions or bumps or any asymmetry that may need some attention. I don't see anything, and Windsor doesn't have any IVs or any bleeding or anything like that. So that's good. And while I'm here, I'm going to listen to your bowel sounds. So after I've inspected, I'm going to listen. So I'm going to start in the lower right quadrant and then work my way up and over to listen to all four sounds, all four quadrants, to make sure that the vowel sounds are present and normal. Okay, everything looks good. Now I'm going to palpate. So I'm feeling for any irregular nodules or any distension. He doesn't have ascites, so that's good. Okay, wonderful. And while I have my stethoscope here, I think I will take a listen to your heart sounds. I guess I can do this. So first I'm going to be listening to the aortic valve, and that is in the second intercostal space on the right sternal border. Then I'm going to listen to the pulmonic valve, which is in the second intercostal space on the left sternal border. Then in the third intercostal space, left sternal border, is Erb's point. Then I'm going down to the mitral valve, the tricuspid valve, which is in the third or fourth intercostal space on the left side. And then after that, I'll be listening to the mitral valve, which is on the midclavicular line in the fifth intercostal space. This is the apex of the heart. So first I'm finding the clavicle, and then I'm going down to the second intercostal space, as I mentioned. So now I'm going to listen to your lung sounds, and I might have you lean forward in just a minute to listen to the posterior. Great. Just take a deep breath. So, you're still feeling okay? Are you comfortable?
Mm-hmm.
I know that two of the side rails are up right now and your bed is locked. I've been checking it, so you're very safe. So I'm going to put this down and then continue with your lower extremities health assessment, okay? So I'm going to remove your blanket. So first I'll continue looking at the skin, just to continue going from head to toe. And I notice that you don't have any stark wounds or bruises, even scars would be noticeable, or something that I would like to document. So the visual inspection looks good. Going down here to the toes, I'm going to first check your pulses, your pedal pulse, yes, those feel good, good. And then I'm going to feel all of the bones in his toes. Does any of this hurt?
No.
Okay. Okay. And so I'm going to palpate right here. If someone were really obese or maybe they were diabetic, they may not be able to feel this area very well, so it's important to check for any wounds. Windsor's feet look clean and free of any sores. He also doesn't have any ulcers on his heels, which is another popular spot for ulcers. So I'll assess both sides of the feet, and then while we're here, I'm going to check your feeling. So can you tell me when you feel something?
Yep.
Okay.
Mm-hmm.
Okay, great. So that was with the soft side of a Q-tip, so we know that he has good sensation in his feet. So continuing the assessment here, I'm just going to palpate more areas of Windsor's feet to make sure that both sides are symmetrical, there's not any nodules that we should know about. Great. And then Windsor, if you could sit up and put your knees over the edge here, I'm going to look at the structure of your knees. So I'm just feeling these crevices here. Nothing hurts, right?
No.
So if there is any sensitivity that he has at the point right here, that may be indicative of Osgood-Schlatters disease. If Windsor had some pain here, this would be really prominent. If he had pain on the side, he might have had a meniscus tear, and then feeling his kneecap here. There could be a variety of reasons that he's having pain, but you're not having any pain, and everything feels symmetrical. So I'm going to test your range of motion. I'm going to do some passive stretches of your knee. Tell me if anything hurts.
No.
Okay. Now I'm going to go in. Okay. It's important to do both sides so we know if they're symmetrical. So this is flexion, extension, abduction, and adduction. Abduction is away, and then adduction is when it goes closer to midline. So everything looks good there. If you could stand up for me.
Mm-hmm.
So turn around, please. Okay, so first I'll just have you stand here. I don't want to get you up too quickly or have any orthostatic hypotension. Are you feeling okay?
Yes.
Okay, so I've got you in case you feel dizzy, just let me know. But right now I'm just assessing his gait and looking at his shoulders to see if they're symmetrical. I'm just doing a visual inspection to see if he's swaying. So everything looks good. If you could close your eyes for me, Windsor.
All right.
And when he's closing his eyes, I'm just assessing if there's any swaying. Both of his feet are together. He seems pretty relaxed, so I'm not concerned with a negative outcome for the Romberg's test. Now that you're facing that way, I'm going to say 3 words, and if you could repeat them back to me, that would be great.
Okay.
Tucker.
Tucker.
Oh, sorry, after I say all 3 of
Okay.
them. Tucker, candle, flashlight.
Tucker, candle, flashlight.
Okay, great. So overall, I've noticed that his neurological state is he's alert, he's oriented. I'm not having any red flags with your brain function. Now I'm going to whisper 3 words, and if you could say those back to me if you hear them.
Phone, driveway, car.
Okay? Now I'll do this side.
Peach, fridge, dump truck.
Okay, great. So now you can turn around and we'll do some exercises on your upper extremities. So first, if you can raise, you can kind of mirror image what I do. Just raise your arm up. Do you have any pain?
No.
Okay, can you straighten it or is it, okay. So then now down. And then if you can go back a ways. And then we'll have you go out and then over. Okay, does this cause you any pain if you
No.
pull your arm? Okay, so if he did have pain there, then it might be indicative of a rotator cuff injury, and then we'll just have you do it on the other side to make sure that everything is parallel and in good condition. Can you go like this? Okay, now I'm going to put pressure down, and can you pull up on your shoulders? Yes, good, okay, that's great. So while you're here, can you make a surprised face? Good. And now smile. Okay, everything is symmetrical. And move your jaws and bite down. And open your mouth and say ah. Okay, great. So the uvula is midline when he opens his mouth, and his soft palate is raising symmetrically. And can you open your mouth one more time and stick out your tongue? Okay, great. So I'm looking for symmetry. If the tongue went off to one side, then that can be indicative of a neurological nerve issue. And just open your mouth one more time, and then I'm going to look under your tongue. Okay, so I'm looking to see if there's any dryness. Your mouth looks moist. Do you do regular dental appointments?
Yes.
Do you floss?
A little bit.
Okay, great. So while you're here, are you in a comfortable position?
Yes.
Okay, so I'm going to feel, just palpate around here. I'm feeling your lymph nodes. Is anything painful?
No.
Okay. Actually, maybe we should sit back down. I'm not sure if the video can see that. Can you sit on the edge? So thank you. So I'm feeling behind your ears, down here. And if anything felt like a nodule, or if anything was movable, then that might be indicative of a concerning lymph node. And then I'm feeling down along here. And in the back of your head. Okay. Everything feels good. While I was doing that, I was also assessing the outside visual appearance of his ear to make sure that there wasn't any discharge or earwax or any concerns in hygiene or conditions of the ear. And everything looks good there. I'm going to feel your capillary refill. Okay, that's good, less than 3 seconds. And then your skin trigger, so I'm just going to pinch your skin. Okay, that went right down. If his skin stayed a prominent, if it stayed out, then that might be indicative of dehydration. Yeah, and you can also feel it here as well. So while your hands are here, I'm just going to feel all of the bones in your fingers. Do you ever have pain in your fingers?
No.
Okay, so if he had pain in his fingers, it might be indicative of some arthritis. Any pain when I press in here?
No.
Okay. Can you touch your finger to my finger? Okay, great. So you have good coordination. He can follow instructions well. And now please place your hands like this, and then place them down. And then press your wrists together. And maybe if you hold that for a few more seconds and you feel any pain or tingling, just let me know. Do you feel anything funny?
No.
Okay. So that you can relax now. So if you felt any tingling after a minute or so, that might be indicative of carpal tunnel syndrome. Another way to assess for carpal tunnel syndrome is the Tinel test, where you would, I would just tap here, and maybe after a minute or two, if you had some numbness in your fingers, then that might also be indicative of carpal tunnel syndrome. So can you move your hands like this? And then up. Okay, so you have good range of motion in your fingers and hands, and then kind of go in and out. Great. And then with your elbow, can you just go up and down for me? Great. So I'm going to visually assess your elbow as well. So that's clear. If patients are in the hospital for a long time and are laying on their elbow, then that might be another place for pressure ulcers. Now can you make a fist? And I'm going to press down on your hands. Okay, so that just engaged these bicep muscles. If this didn't go as it just did, then he may have some issues with these muscles as well. But overall, you seem to be in great shape with great muscle tone, and you look healthy. Do you have any questions for me?
No.
Okay. The last thing that I want to look for is if you could stand up for me. I already assessed the symmetry of your back right here, but I would like to take a peek at your spine. So I'm just going to pull your shirt up for a second and have you bend over. Okay, so both of his shoulders are symmetrical. There's no asymmetry in any lumps on his back. And then I'm also feeling his hip bones right here to make sure that these are similar as well. Do you have any pain when you touch your toes like that?
No.
Okay, so I'm just going to palpate the muscles. And then earlier I already felt the vertebrae and those were all aligned. There was nothing stepped out of position. Okay, well you can have a seat and I'll get you tucked away back in bed. Here's my stethoscope. So right now your bed is in the lowest position with 2 of your bed rails up and it's locked, and you have your call bell here.
Okay.
And would you like any water or anything before I leave?
I'm alright, thank you.
Okay. And you still aren't in any pain?
Correct.
Okay. And do you have any final questions or anything you'd like to discuss with me?
No, that was great, thank you.
Okay, thank you. And one more thing on my end. If you could just watch my fingers,
Okay.
I'm going to take a peek at your eyes.
Okay.
So this is going to test, I'm just going to follow your eyes, your 6 fields of vision. Okay, great. And then watch my hand come in. Okay, perfect. And I am going to bring my hand forward. Let me know when you start to see my hand.
Yep.
Okay, and this side.
Yep.
Okay, so that was just testing his fields of vision, his peripheral vision, his accommodation when things went in. And then if I had a pen light, then I would come in like this and make sure that both of your pupils were dilating, to make sure that both of his eyes were dilated and reacting equally to light. So Perla, pupils are equal and reactive to light and accommodation. So you don't have any problems with your vision, so that's good.
Okay.
Great. Thank you very much. And again, here's your call bell, and the doctor will be in soon.
Thank you.